Education for learners with special needs is not only a moral right, but also a sound, pragmatic investment. And it promotes equity and strengthens social cohesion. In recognition of this, the amended Get Fund Act has established a dedicated, sustainable funding framework to implement free education for learners with special needs, beginning in the 2026 academic year. Government has also increased the daily feeding grant for students in public special schools from 8 cedis per day to 15 cedis per day. This significant increment reflects our resolve to address the unique nutritional and health needs of learners with disability. In addition, Mr. Speaker, we'll construct a modern state-of-the-art special needs school in Ho in the Volta region, and will rehabilitate and upgrade the existing special needs schools in Okropong, Ekwapim, in fulfillment of our pledge also to provide free sanitary pads to schoolgirls as part of efforts to improve menstrual hygiene and reduce absenteeism among female learners. A total of 12.2 million packets of sanitary pads were distributed to girls in public schools across the country in 2025. Mr. Speaker, we allocated in this year's budget 292.4 million Ghana cedis to sustain the free sanitary pad initiative. This commitment aims to remove gender-specific barriers to education and ensure that no girl's education is interrupted due to challenges related to her menstrual hygiene. Mr. Speaker, as part of efforts to decongest senior high schools and increase access and ensure parity in educational opportunities, government is going to convert and upgrade 30 Category C secondary schools to Category B, and convert and upgrade 10 Category B schools to Category A. In addition, facilities in Category A schools are going to be upgraded and expanded to be able to take in more children. Technical and vocational education and training remain a critical pillar of our strategy to address youth unemployment and accelerate skills development. Government will construct 6 brand new regional TVET centers of excellence across the country to equip our young people with practical, industry-relevant skills aligned with the demands of the evolving job market. We're also undertaking a review of the national curriculum to align with the OECD Future of Education and Skills Framework. This will make TVET education more adaptive and resilient. Mr. Speaker, to expand access to higher education and support balanced regional growth and meet the rising demand for quality tertiary education, we've entered international partnerships to establish 2 new public universities, one in Kentapo in the Bono East region, another in Jasikai in the Oti region. I'm happy to announce also that a grant has been sourced from China to establish a new public university in Damango in the Savannah region. Mr. Speaker, technical universities play a government is going to establish 3 new technical universities to strengthen skills development, enhance innovation, and support national industrialization efforts. Mr. Speaker, the Teachers Housing Initiative is a joint effort involving district assemblies, Common Fund, Get Fund, NAT, and JESOPs. And the aim is to build 50,000 housing units for teachers. This initiative is called the Teacher Dabre, Bibia Teacher Beda. This partnership demonstrates our collective dedication to enhancing teachers' living conditions and boosting the retention of teachers, especially in rural and remote areas, and ensuring that teachers can live, work, and retire with dignity and security. Mr. Speaker, by prioritizing equitable access and expanding infrastructure, we're investing in human capital and laying the foundation for a Ghana where every child can learn, grow, and succeed. Mr. Speaker, our health system. By January 2025, our health system was under severe strain. aging and deteriorating equipment, stalled hospital projects amounting to 15 billion Ghana cedis in liabilities, and growing workforce pressures had weakened service delivery. Over the past year, donor support to our health sector declined sharply from 19% of our total health budget to just 2.2% today, creating an annual financing gap of more than 2.4 billion Ghana cedis. The withdrawal of support from programs previously financed by partners such as the USAID exposed the vulnerability in essential supplies and services, particularly in remote and underserved communities. Faced with these realities, my government chose to act decisively. In 2026, direct government funding for health will account for about 72% of our total health spending. This is up from 56.8% in 2023. Core health allocations have risen to GHS 23.3 billion, and with national health insurance resources included, total health financing now stands at 34.7 billion Ghana cedis. This reflects our clear commitment to domestic financing and health sovereignty. At the same time, we have faced the growing burden of non-communicable diseases. Today, non-communicable diseases account for over 40% of all deaths in Ghana and remain a major cause of household poverty. To address this, the government established the Ghana Medical Trust Fund, otherwise called Mahama Cares. Mr. Speaker, this is the first nationwide financing mechanism dedicated to chronic and non-communicable diseases. Mr. Speaker, the National Health Insurance Levy has been uncapped. Claims payments are now timely, with facilities no longer waiting more than 6 months as happened in the past for payment to be made. We're also finalizing measures to increase provider tariffs by over 100% to reflect the realistic cost of health treatment. As a result of the increased trust, NHIS enrollment has risen from 57% at the start of 2025 to 66% today. Mr. Speaker, Ghana's health workforce density has risen from 16.6% per 10,000 people in 2025 to nearly 42 per 10,000 today, while public sector health employment has doubled to approximately 200,000 workers. And yet, significant challenges remain. At the beginning of 2025, when we took over, 103,000 trained health workers were still awaiting placement, employment or enrollment onto the payroll. Over the past year, 13,500 nurses and midwives, along with hundreds of doctors and pharmacists, have been absorbed into the public payroll. Nursing trainee allowances have been regularized and restored. Application fees have been reduced, and the no-fee stress initiative introduced to ease access to training has been extended. Service conditions are being implemented to boost morale and retention. Looking ahead, government will expand recruitment and take necessary action to add more health workers onto the payroll. We will also correct the maldistribution of health workers through targeted incentives for health workers who agree to serve in underserved areas. Let me use this opportunity to appeal to our gallant health workers to accept postings to our underserved areas, seeing as it is a national call to duty, while we work to ensure that they have an enabling environment to do their work. Mr. Speaker, we will also scale up specialist and advanced nursing training to match the country's changing disease profile. New post-basic nursing programs in cardiology, nephrology, endocrinology, and oncology will be introduced. While the two existing ones, emergency and critical care nurses, will be scaled up. At least 30 nursing training institutions will transition to competency-based degree curriculums. supported by new scholarship opportunities for PhD-level training for nurses and allied health professionals. Mr. Speaker, on health infrastructure, my government remains firm in its commitment not to abandon unfinished projects. We will continue to retool facilities, strengthen emergency and disease surveillance systems, and ensure that health infrastructure is properly aligned with staffing, equipment, and financing. In 2026 budget, provision has been made to commence regional hospitals in Oti, Savannah, and the Western North regions. This will expand access to quality care. Aligned with the reset agenda, we're making strategic investments in local pharmaceutical and vaccine production. The government has allocated 50 million in seed funding to the National Vaccine Institute. And in 2025, a local manufacturer secured market authorization to produce snake venom antiserum right here in Ghana. We're also finalizing steps to implement an advanced market commitment to prioritize locally manufactured vaccines and pharmaceuticals in public procurement. Production of the tetanus diphtheria vaccine is expected to commence this year through a partnership with an Indonesian pharmaceutical firm. Disease control remains our priority in our country's immunization financing. We will strengthen immunization financing. In 2025, the vaccine budget for children and pregnant women was increased by 46%, exceeding the 171 million Ghana cedis. And this enabled Ghana to fully and promptly finance all its vaccines and reduce the risk of preventable outbreaks. In 2025, we also introduced the HPV vaccine to protect young women and girls against cervical cancer. Mr. Speaker, Ghana's HIV prevalence rate is estimated at 1.6%. And as I speak with you, there are about 350,000 of our countrymen and women living with HIV and AIDS. Mr. Speaker, although prevalence is low, some population segments and regions have significantly higher incidence than the national average. The Ghana AIDS Commission has been tasked with ensuring the availability of testing and antiretrovirals. This year, government will fully roll out a free primary health care program, removing all cost barriers at the primary level where it is most needed, while strengthening prevention, screening, and health promotion, especially for non-communicable diseases. The Ghana Medical Trust Fund will be scaled up, and access to advanced cardiac care, including cardiac catheterization services at Tamale, Kolebu, and Komfo-Anokye Hospital, will be expanded to reduce overseas referrals and position Ghana as a center for specialized care in the sub-region, in line with our medical tourism objectives. Mr. Speaker, the Ministry of Health is expected to issue guidelines to eliminate the unacceptable no-bed syndrome. Patients facing medical emergencies must be received and given help, if even under makeshift conditions. You don't need to have a comfortable bed to save a patient. No patient must be turned away from any health facility they report to. Mr. Speaker, but in the meantime, government will expand capacity by implementing the Rich Hospital Phase 2 project to increase the number of beds at the Greater Accra Regional Hospital. We will also continue and complete the police hospital project, and also continue and complete the La General Hospital. Mr. Speaker, in the Ashanti region, we will complete the Sewa Regional Hospital. We will complete the Aferi Military Hospital, and we will complete the Komfo-Anokye Teaching Hospital Maternity and Children's Block. Mr. Speaker, we remain on course to build a stronger, more resilient, and more self-reliant health system for all Ghanaians. Mr. Speaker, roads are a very important sector. We inherited a burden of significant financial obligations and structural pressures in the road sector that had accumulated over the years. As of December 2024, outstanding payments on road projects financed through the consolidated fund stood at 21 billion Ghana cedis. These were